Hey guys, welcome back to my channel. I hope you guys have been amazing. I think now I have the energy to make video. Um, anyways, you guys saw in my last video that where I was talking about my delivery that eventually I had a vaginal delivery with an induction of true um induction of labor, and I told you guys how it all went and how I ended up with epidural and how the epidural was really helpful. Like, I can't imagine going through the last phase of labor without that epidural. Like, I'm sure it would have been so traumatic that we never ever want to get pregnant again in my life because the pain was mad. Like, baby ended up being 3.6 kg. So, or 3.5, 5, is it 5.6 or 5.8 kg? So almost 3.6 kg. So because of the fever I had after the delivery, my baby too also had a high temperature, and so they were like they can't risk neonatal sepsis, and so they must screen him fully for sepsis before we can be discharged. So that's why we have been in the hospital. This is like over 2 days post 48 hours of after my delivery, and usually you're supposed to go home like the next day if it's a vaginal delivery, if it's uncomplicated. I'm supposed to go home the next day, but here we are. I delivered on Sunday almost midnight, and here we are. Today is Tuesday midnight, so it's already like 2 days in the hospital. And I had to take some IV antibiotics in case there is an infection that is brewing somewhere and all of that. And they've done my culture and other tests just to check for infection, and everything is clean now. So I'm currently on oral antibiotics just to finish up the treatment. So they are still investigating my baby. They still took sample yesterday, and I'm so glad that they are being proactive about it, because I wouldn't be happy if we actually went home and then we now have to bring him back and start dealing with maybe infection or something like that. That would be too stressful for me. So I actually don't mind that I have to wait extra 2 days, just to be sure that he's fine and that there won't be any worries or concerns when we get home. The experience, I would say it was an awesome experience. Like, if there's anything more than 5 star, I beg, I go give them 10 stars, 100 stars. Like, it was an executive treatment. You get, like, I don't know, like, it was just like, where in the world does this happen? You get, like, every singular person at every point made you feel like you are very important. You are a very special person. All the midwives that I met, all of them were superb. All of them were nice. All of them were sweet. The one that for me was really like the height of it was on Sunday morning. I remember the midwife that took over in the morning, Sharon. She was so nice. God, like, at some point she was so worried about me because I was monitored almost all through the day. At some point when I became tachycardic, like my heart rate increased significantly, and she was so worried what could be causing it. And at some point it was as though my baby's heart rate too was dropping, and it was beginning to look like things were changing, like in a negative way. And so she came, she sat down with me, she just made sure she kept checking, she kept adjusting, she just kept checking. I was like, wow. At some point my husband had to ask that, babe, is it a nurse to a patient? I said, no, it is not a nurse to a patient. That I'm sure it's not one nurse to one patient, but she actually made me feel like they just assigned her to just me alone. Yeah, because she was just very around. Fine, she had to step out sometimes, I'm sure, to attend to some other patient, but she will come back inside. Am I okay? Am I all right? Do I need anything? And I don't know, here, like, the treatment is awesome. You get, like, nobody even comes into your room, without knocking or asking for your permission. Talk more of touching your body, or examining you, or doing anything without your consent. So, like, they take your consent for everything, even to enter your room, even to clean your room, even to give you food. They will ask you, what food do you want? Like, you order for your food, you get, like, I don't know, maybe because I don't really know how to eat their food, maybe that's why I didn't really appreciate the whole food aspect. But I feel that was something. You get, like, They come asking for your food and everything. Or what do you want? And intermittently in between meals, they will even come and ask you, do you want anything? Do you want any drink, tea, coffee, juice? They will offer you, they will just like that. They can do that like up to 4, 5 times a day. And I'm like, gosh, where is this? Like, even in my own house, I don't give myself tea like 5 times a day. You get, but they just keep coming, and it's just superb. Like, the treatment was amazing, amazing. And then the midwife that now took over, the one that eventually delivered my baby, was awesome. She was so lovely and so motherly. She was so caring. Like, I don't know if I would have been able to go through that labor like that without her. Fine, she had the expertise and maybe the years of experience, but much more than that, she was so sweet. She kept encouraging me at every point. I remember there was a point, the part where I was supposed to push and everything. Of course, I had a epidural, so I wasn't really feeling strong contractions and everything. And I remember I didn't even know how to push. She had to really want to explain to me how I'm going to push, what I'm supposed to do. She talked me through it and everything. And then I remember after the labor, my husband was like, "Babe, do you know that at some point, all those times that you were pushing and your midwife was telling you, yes, good girl, you're doing very great, you're amazing. Now that time, do you know that you are not pushing nothing?" I was not like, "Are you serious?" I was not like that the woman just gave you ginger to do the thing. I was not like, seriously, that she was saying it. I thought I was actually really doing the thing. It was not like that. I wasn't doing anything initially, but I guess it was because of the way she kept encouraging me. I kept feeling like, oh, I was doing the right thing. So I kept doing it until eventually I pushed out my baby. So she was very, very attentive. She was so caring. She was super nice. And I'm like, hey, these people, you are tempting me to actually get pregnant again in the next few months. But I'm just joking. That's a very serious joke. I'm not going near any pregnancy for the next 1 year, babe. Like in the NHS, the fact that you don't have to pay for anything. You get like you just come and everything you need, everything you will use. You don't have to worry about the fact that you will pay, or maybe you have to go somewhere to go and do something or something. Like everything just appears. You get, they need this, and when I looked at everything that was used for only my delivery, I was like, what? Like now I understand when NHS is talking about their budgets like in billions, and now I understand why. If only me alone got all of this, that how much more every other person, pregnant woman, every other sick person in the country and everything, that it is actually really, 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 really worth it. You getting to care for a newborn with no experience. And Charlene, it's been an awesome experience anyway. The last 2 days, even though I've been so sleep deprived. Yesterday, I couldn't get any sleep because this boy was just crying. Like he was just crying like maybe like every 30 minutes. I didn't even know what he wanted at some point. I was just frustrated at some point. I was just like, what do you want me to do? But I just have to find a way to get that for him and also adjust to the new estate. It is well with my soul.